sign into Vimeo. And there we are. I think we are live. I'm going to hang up on you. All right. Well, hey, welcome. A little off to a kind of an interesting start there, trying to get us going on our live stream today. And we're going to be talking about myths. Myths, why sometimes things work on the internet and sometimes don't. No, that's not what we're going to talk about. Hey, welcome to the Autism Education Network. This is brought to you by our product line, Mending Naturally. And you know, there are a lot of myths out there still. And I was kind of looking at the myths of autism earlier today just to see what was currently out there being published. And would you believe right now it's still, now we're not talking about something from 2005, we're talking about something from this year. They'll still say that the myth that autism is actually increasing. It's a myth, it's not. The only reason there are more cases of autism out there apparently is because there are better diagnoses made, and because we've changed the criteria in the DSM-4, DMS-5 manual, there is more autistic kids. Okay. Another myth that follows right on that is that autism is a fad diagnosis. In other words, it's the fad because everybody wants the diagnosis so they can get all the freebies that come along with that diagnosis. Now, I heard that over 20 years ago, and I remember calling my wife and saying, did you know this is a fad diagnosis? And if we do not want the freebies that come along with our son's diagnosis, then he doesn't really have autism. Try that sometime. There's a myth out there that autism can be cured with diet and supplements, so therefore it's a myth, don't even try it. And that one's really true. In fact, I had some patients recently diagnosed at UCLA in Los Angeles, California, and they were specifically told after the diagnosis, don't even bother with the gluten-free, dairy-free diet, it doesn't work, and just stay away from supplements. Your child has what they have, and you may think about signing them up for an institution soon. And the other one is, you're still young, you can make more babies, and chances are they won't have the diagnosis of autism. Again, a current myth, you guys will like this one, right? Is that autism is really a group of highly evolved individuals who are savant geniuses, and they are going to lead us into the next century. Savant geniuses. Okay, I'm not going to say much about that, except that I don't see too many savant geniuses. Now, I do see savants in my clinic, music savants who master guitar, piano, singing, mathematics. So I do see some of those incredible abilities, but it's very, very narrow. In other words, they only have a very thin skill set, and what they do, it's 150% perfect, but everything else they struggle with. Now, the next thing that we can look at is the myths of what autism is or isn't. And of course, there's the big defense out there. The myth is that autism is caused by vaccines. It's been totally debunked, and that's a myth. It was all started by that evil guy, Andy Wakefield, who came up with a whole bunch of data that was made up. The problem with that I never see addressed is the pathologist who actually looked at the tissue specimens from the children with autism who did undergo endoscopy, really did demonstrate inflammatory bowel disease, and that was never debunked. Those kids truly had a treatable disease called inflammatory bowel disease, and nobody's ever gone after the pathologist as making up false data. So wait, there's as you can imagine, a lot more myths to talk about. One of them was that the gluten-free, casein-free diet cures autism. Well, I don't think anybody ever says it cures autism, but it certainly can improve it. In fact, at 80% of my clinic, when our children go on a gluten-free, dairy-free diet, they improve 80%. Now, I didn't say cure. And cure is a kind of an elusive term anyway when you talk about it. The myth out there that the self-injurious behaviors, and a lot of what we're going to talk about, is just autism. No, the self-injurious behaviors are a response to something going on that's not feeling good, whether it be migraines or inflammatory bowel disease or anxiety. It's not because they just want to wallop themselves, bite themselves, punch themselves, smash their heads into concrete or walls, or break glass with their heads. Okay, so we have to be a little bit careful about how we interpret their behaviors. Nighttime awakenings. Well, everybody knows that children on the autism spectrum don't sleep well, like most other psychiatric disorders. Again, so therefore, since it's the child's fault because they have autism, they're not going to treat it. I don't see this too often, but it's still out there. Autistic children are intellectually challenged. Can't expect too much from them. The old term we used to use was mental retardation. And that too is going to be challenged in light of what we know about autism these days. Intellectually challenged. This is one of my favorites, chronic constipation. And this will come from your ABA therapists. They're going to say that, well, you know, the only area in your life that your child truly has control over is their anal sphincter, and they're controlling when they're going to poop and when they're not. And when they don't poop, that means they're just don't want to do it. It's under their personal control, and they're not going to let it go. It's willful withholding stool behavior, and there's nothing we can do about it. So that's another myth. Allergies. This is a good one too. Our food sensitivities, our food allergies, or how about just our sensitivities to our environment, whether it be molds, which my son was incredibly allergic to. There's no such thing as food allergies with these kids because they went to see the allergist and they were tested, and there you are with the prick test, and they're not allergic, so therefore that's not allergies. Oh, we can keep going, can't we? Endocrine dysfunction. There's no such thing as adrenal fatigue in these kids. They either have Addison's disease, which means no adrenal function, or they're fine. And you don't have to look at that. Hormone dysfunction. Now, you know, if your kid's growing well, we don't have to check the thyroid, and we certainly don't have to check the sex hormones like estrogen, testosterone, progesterone, because everybody knows these kids are fine. Even if they're going into puberty in second grade, everybody knows that especially Hispanic autistic children or African American autistic children are going to develop early anyway, and that's normal. Really? All right. So we are still up against a lot of myths out there that are being perpetuated as truth. They give you these false narratives about what autism is, and because they don't really want to treat it. Well, I shouldn't say that. There's always one group of doctors who will be more than happy to treat your baby. I'll be the psychiatrist, and they'll put your baby on Risperdal, Prozac, Zoloft. You know, Zoloft is actually FDA approved down to age 6. Can you imagine putting a 6-year-old on Zoloft if you haven't tried anything else, really? And Risperdal has been clinically proven to be effective in these kids. Risperdal chews up brain cells, has a high predisposition to cause excessive growth of breast tissue in boys. I've even had two boys who have had breast reduction surgeries because they had Risperdal when they were little. Risperdal can also lead to type 2 diabetes. So there's a lot of issues out there, but that's what you're up against as a parent with a child on the autism spectrum, and you're being told by very prestigious universities, medical centers, whether it be the Mayo or Johns Hopkins or UCLA, that these are the issues and they're non-issues. This is just autism. There's no increase in autism. You're just one poor unfortunate soul who happened to get an autistic child. This wasn't created by environmental factors or vaccines or whatever you read out there. This is just a genetic thing that happened. The problem is they haven't found anything genetic that causes autism. The other thing that you have to keep in mind too is that this upsurge in the ability to diagnose autism is worldwide. And I see these families from all around the world. Just about anywhere there's a human population, there's going to be more autistic children. You know, and again, they'll say that, well, we just used to call these kids something else, and when it was fashionable to call them, we would have just called these kids mentally retarded, for example, or schizophrenic. Well, I've been doing this a long time, and there are teachers who've been doing their teaching even longer, and they didn't have in the 1960s and the 1970s and the first two-thirds of the 1980s, they didn't have special rooms for these kids, you know, classrooms, special needs classrooms. And they said, well, that's because they weren't going to school, they were still at home. Okay, so where are they all now? If the number truly is, I'll just use something conservative, 1 in 60, then where is 1 in 60 adults who are dysfunctional, who are flapping, who are doing self-injurious behaviors, who have no language? Where are tens of thousands, if not millions, of people, not only in the United States, but all around the world? Where are they? They can't still be home. Their parents would have aged out by now, especially if they were born in the 1950s and 1960s. So there's a lot of work that still has to happen, and I'm hoping in my lifetime that autism will be truly recognized what it is. So where do we go with this information? Well, that's why we talk about all that we do each week. We talk about if you have sleep issues, maybe we can go back to a 1990 study that looked at, when they were actually studying some of these issues, which they're not doing right now, looked at adults and children on the autism spectrum have decreased melatonin production. Then we have a child now who's, say, 6, coming to see us. Their mom says, this kid will not sleep. Maybe we should give him some melatonin, would be my really, melatonin. Here's another myth, okay? Whatever you want to do, say melatonin, because we're talking about melatonin, it's dangerous. We shouldn't do it. I mean, if you give him melatonin, he may never make melatonin again on his own, and he'll be addicted to melatonin. Well, we're already addicted to melatonin, just like we're addicted to insulin and thyroid and a lot of our hormones, because without them we can't live. My son is a diabetic, type 1. If he doesn't get insulin with each meal and snack, he will die. He's addicted to insulin, if you use that terminology. But what if he wasn't making quite enough insulin? Well, I don't want to give him any insulin because he'll be addicted. Wait a second, that doesn't make sense. Now the next thing is, I'm actually giving his body something that it normally makes. So when I have a child who's not sleeping well, I can actually give the body something it normally doesn't make, melatonin. I'm not giving him Lunestra, okay, one of those medicines that they talk about on TV about sleeping. I'm giving him melatonin. His body makes melatonin. And the piece de la resistance is when I give the kid melatonin, he sleeps. So basically I diagnosed he probably has a melatonin deficiency. I give him melatonin. What's the clinical result? He's sleeping through the night. Score, right? Okay, but when people tell you, oh, you shouldn't do that, it's dangerous, then I'll say, okay, what are you going to tell this family who's up 20 hours a day, every day, day in and day out, with a screaming kid? What are you going to recommend? And then all of a sudden, you don't hear anything. Okay, so it's don't be so quick to take away other people's things. So anyway, hang on one second. David just sent me something. When you turn your head to the right, it messes up the sound. So I'll say, well, don't turn my head to the right. Then he says, turn my mic up. Okay, so let's go to input and sound up. Can do. We'll see if that works. Okay, so sound is up 100%, Dave. Now, the next thing that we have to think about is the stooling. If the child has chronic constipation, they're already communicating with you. I can't have a bowel movement on my own. Whatever is involved neurologically, hormonally, the signaling devices between my brain and my colon aren't working, and I can't have a bowel movement. And I saw a child today where I asked the mom, how are things going? We get down to the stools, and she goes, well, he's moving his bowels daily. I don't have to chop them up so they can flush. Seriously? But that's what we have to do. Especially for you guys in California, even a regular stool won't flush. You can't. I mean, how do you flush a stool with 6 ounces of water? But anyway, I digress. What did we do with that child? We put him on magnesium citrate. Magnesium citrate. Yes, I know, our bodies don't normally make magnesium citrate. So now we do have to reach into what's available to help our kids move their bowels and safe and not be addictive or cumulative and all those things. And for this particular child, magnesium. So I'm giving this kid some magnesium, and we're moving our bowels great. How easy is that? I'm giving the child melatonin, and we're sleeping now through the night. How easy is that? Again, people will tell you, well, you shouldn't have to do that. I agree. The safest thing to do with any child is nothing. That's the safest thing to do, because anything I do, including melatonin, can have side effects. Melatonin can cause nightmares. But it's funny, in the pediatric literature, if you have a child who has nightmares, you give them melatonin. So melatonin can cause you to wake up after 4 hours, and I mean really be awake for some people. So I can't use melatonin there. But at least we start using the safest things that are available, that if we can mimic what our body would make if it could. So now I have a child who's pooping and sleeping. How much better do you think that child is now to cooperate daily with the therapists? So if you look again, if you research what is really working for our kids, the only thing that's really been researched out there is ABA therapy. When you look at ABA therapy, they'll all tout that it's the only thing that's been proven to be beneficial for these kids, and everything else is not so much. Well, yeah, because nobody's actually, it's not that it doesn't work, it's just that nobody's doing the work to do the studies. Why? Because studies cost hundreds of thousands of dollars to do. You have to have two groups, one group that is getting the treatment, say melatonin, and another group that's getting the sugar pill, not melatonin. Neither group knows what they're getting, and then you have to do that. So there are other studies, which we call the N of 1 studies, that you don't have to have the control group, but nobody's talking about those anymore. Nobody wants to look at that. They all want that gold standard. Then they say, well, how many participants did you have? Oh, you only had 12 participants? That doesn't have the power that a good study needs. Then you do a good study with the power that they need, say with 100. Then they say, well, you know, it should be a multi-center study, okay? So it takes a very long time, a lot of money, and quite frankly, still, they're not very interested in studying our children. For the life of me, I can't figure that out. Something that's affecting 1 in 34, 35 males. Of all the boys born this year in the United States, in 2 to 3 years, 1 in 35 can become one of my patients. That's frightful. That's frightful. So I can't retire anytime soon, obviously. So we have to figure that out. So something that's causing that much difficulty, and we're not talking about little wisps of hair that grow left instead of right. We're talking about lifelong disabilities, lifelong suffering for the child who can't sleep, who can't poop, who can't learn, who can't speak, and lifelong trauma for the family members. Because as you guys know, taking care of a child with special needs is unremitting sacrifice on your parts. Financially, spiritually, emotionally. It tears apart relationships. Husbands and wives separate over this stuff. It's really, really difficult. So let me take a look, see if I've got some emails that we have to do. Yeah, there's some questions here. So we got a question. So Maria asks, how can we avoid regression in an autistic kid? Okay, so Maria, we have two things here. We have a child with autism, Okay? And how do we avoid regression? That's a tough one to answer. So if your child is gluten-free and dairy-free, or low sugar, and gets macaroni and cheese and a bunch of Halloween candy, we're going to have a big regression. I promise you that. If they're sensitive to gluten, dairy, and sugar. So the obvious answer there is make sure they don't get gluten or dairy or sugar. Okay? If you have a child who regresses because of constipation and they become violent and aggressive and pinching and biting, then the answer there is let's not let them get constipated. On the other hand, if you have a child who's not sleeping at night and all of a sudden stops sleeping, first we have to figure out, is it a dietary infraction, is it constipation or a bowel issue, but then we have to give melatonin. So I'm thinking that if you have a child with special needs and you've already figured out how to make them better, if you take away something, and this happens all the time, like we ran out of the 5-HTP, and all of a sudden our kid's becoming very obsessive compulsive. Or my child was in school and strep throat was going around and he started to regress. These are all things that are treatable. You just have to be aware of your child's particular issues, what your child is sensitive to, and then obviously not exposing the child to those things if possible. I mean, how do you not expose a child to strep throat? But then you gotta be ready to, unfortunately, treat them with an antibiotic like azithromycin or cephalexin. All right, let's see what other questions we might have. Okay, so here's a question about the methylation pathway, and we've answered this a few times. The methylation pathway, again, if you find that something works, like giving B12 injections, as many are able to do if they have a physician, along with vitamin B6 and a very special form of folic acid called leucovorin, and something like DMG, dimethylglycine, or trimethylglycine. Those things are going to help with language, focus, concentration, being more aware of things. And if all of a sudden you stop one or more of those ingredients, it does two things. First of all, it will cause regression, kind of like what we were talking about. The other thing is it proves their value. In other words, you're saying we're doing all of this stuff for our child, and I don't know what's working anymore. Well, invariably, we stop doing all this stuff for the child, and you'll find out really quickly what's not working anymore. And have to restart it. So sometimes that happens. Parents get tired and they say, we're just going to put our child on a supplement holiday. Sometimes I get a child who comes to see me for the first time and they come in with like 200 supplements. And I'll say, which of these supplements are critical that you know of? Well, calcium, they'll say. Well, calcium is important, but if I stop the calcium, you're not going to see a behavioral change, most likely. Melatonin. Oh, now melatonin is important because if you don't give melatonin, they won't sleep. He's on magnesium citrate. Well, that's for the bowels. Let's not stop that. What about vitamin D? And then there's a whole other supplements that parents read about that are very important for their kids, and they start them on it, and next thing you know, they're giving 20 or 30, and I'm like, I think we need to start all over. So except for mission critical that you absolutely know that will change the child, such as not having a bowel movement, not sleeping, not speaking, loss of language, then I would definitely go with that. We're going to go on a supplement holiday, except for mission critical things, and then we'll take a look at who that child is in about 3 or 4 weeks, and unless something happens sooner, and then restart or retarget things. In other words, let's work with supplements that are clinically relevant, that will make a change in your child's behaviors or life. Okay, some things you do need, like calcium and vitamin D, and I'll never get a call from somebody saying, thanks for putting my kid on calcium or vitamin D because he's now doing much better at school. Not from calcium or vitamin D, but other supplements certainly can. All right, so that's our topic on myths. And I don't want you to get sidetracked or discouraged when you read about, from prestigious journals, or you read about or hear from other doctors that doesn't work. Oh, I got one more live question, and we do have time. It's Maria again. Hi, Maria. What are your views on Andy Cutler chelation? Okay, well, Dr. Andy has passed away, unfortunately, and he came up with some very interesting thoughts about chelation. As a PhD, he never chelated anyone. Okay, so he's never had to sit in the seat of a physician and actually chelate a 2-year-old or a 4-year-old or a 5-year-old. We have to work with the families and the children, and one of the mainstays of chelation for him was go low and go slow, but go frequently. And that's always a good idea, especially with the younger children, to use small doses more frequently. So I like that. But I'm not into waking the child up at 2 in the morning to give a chelating agent. Now, I've been chelating since the 1980s, before it was a, if you will, a fad that everybody wants to do. We were chelating children back then who were eating lead paint in city housing. Okay, paint was curling, and the kids would eat the curled paint off the windowsill, and it was lead paint back then. So we were taking care of children who had lead toxicity and maybe some other things they ingested. There's always this story about how the 4-year-old brother gives the 2-year-old sister a bottle of Flintstones with iron, and the child gets iron overloaded after they eat the whole bottle. Okay, I mean, really, Flintstones? But kids are kids. So we have to be very careful what we have around the house, especially when you have a special needs child, right? But anyway, so there are different ways of chelating, and I like to use a chelator that I can actually measure the urine excretion of heavy metals. So I tend to get a urine heavy metal screen before I do anything, and see what the child puts out on any given day over 6 hours time. Say a Friday. Then Saturday I'm going to pick a chelating agent, and it's a real medication, and I'm going to give them just 2 doses, one at 8 in the morning and one at 12. And I'm still going to collect the 6 hours of urine just like I did on Friday, but now on Saturday, and I can compare apples to apples. Here's 6 hours of urine from 9 to 3 on Friday without a chelator, and here's 6 hours of urine on Saturday, but the difference is we have a chelator. And I can demonstrate to you, to me, what the child, if the child has any heavy metals to chelate. So I don't like to just, oh, I'm chelating with silica, or I'm chelating with, because I'm going to want to know, well, what are you chelating, and how do we know we are chelating? So irrespective of what I think about, say, Dr. Cutler's approach to chelation, most of us doctors who do it have to first validate that there's something to chelate, and then we have to put them on the safest course of chelation. Okay. Oh, David sends me a bonus live question. And Melissa asks, what supplements do you recommend for focus and anxiety? For me, I like coffee. For our kids, I might actually choose coffee too. But let's talk about focus, concentration, anxiety. First of all, I have on other video blogs different discussions on anxiety that you need to watch. 30 minutes about how I treat them, because you're going to want a 30-minute discussion in a 3-minute response, and that's just not doing you justice. So I'm going to steer you toward looking at the other video blogs that you see for anxiety, focus, concentration. It's a long topic, and I don't want to shortchange you on that. So I've talked about them at length, and I think you'll find them pretty exciting. But I like to use ashwagandha, I like to use valerian root, I like to use CBD, I like to use L-theanine. These are all things that calm the brain, help it to focus. For anxiety, we've talked about trying to find the source of the anxiety, whether it be constipation, the wrong bacteria, yeast in the stool, and then one of my favorites, too much adrenaline. And that's when I block it with a beta blocker, alpha blocker. So I don't want to, we could probably spend another 2 hours on that one. And I think, why don't you go ahead and look at some of those video blogs that I've discussed these specific topics about in the past. And then next week, well, not next week, because I'm going to be out of town next week, but the following week, you go ahead and email me back specific questions, okay? So that's all the time that we have today. And I just want to thank you so very much for watching the show about myths, okay? I hope that helps you out a little bit, understanding what's going on in our medical community and why things are so darn slow coming up with real tangible things that doctors do everywhere and not just a few of us. So during this next couple of weeks, have a very great time with your children, a great time in the fall. It's just absolutely lovely here in Florida. I know it's snowing in other parts. You guys take care, and I look forward to talking to you in 2 weeks. Bye-bye.